Good morning, everyone. I'd like to thank you for joining us. I'm Gina Ford, Communications Director for Prince George's County Executive Angela Also Brooks. This morning, the County Executive and Dr. Carter are going to bring an update not only on our latest COVID numbers, but also, of course, an update on our vaccination response. So first, we'll hear from County Exec Also Brooks.
Good morning, everyone, and thank you so much for being here. I'm joined by our Chief Health Officer, Dr. Ernest Carter. I certainly want to thank him, as always, for being here. He will give an update on the state of COVID-19 in our community. I'd like to also give a huge thank you to our entire county health department who have worked tirelessly over this entire year, but they have really ramped it up even over the last few weeks. They have worked so very hard. In fact, many of them have worked over the last few weeks without a day off. And they have been working not only to execute our vaccination plan, but to ramp it up. And I just want to give them a huge thank you for the tremendous work that they are doing. Today, I'm here to deliver an update on our progress with the COVID-19 vaccine. We continue to move forward into phase 1B of our vaccination plan, which will allow many of our senior residents to sign up and receive the vaccine. I will elaborate more on Phase B and what it means for our community, but I first also want to offer some words of caution about the spread of the illness. Over the past few months, quite to my disappointment and dismay, and during the holiday season, COVID-19 numbers in Prince George's County have increased greatly. Prince George's County, and this has happened all across the country, and is no exception in Prince George's County, but we have seen a tremendous rise in our cases, and we're asking all of our residents to please continue to take this virus very seriously. It is rampant. Dr. Carter will talk about it in just a moment, but it's just spreading. And I want to remind every resident in our community, please do all of the things that we have requested of you from the very beginning to limit your travel. We're asking also that you make only essential trips, to avoid gathering. I know it's hard to do with people from outside your household, to please wear your masks in public and practice social distancing. Since March, Prince George's County has seen 63,316 confirmed cases of COVID-19, 6,479 of our residents have been hospitalized, and 1,144 Prince Georgians have lost their lives. So this has been an unbelievably difficult time, and we continue to pray for and work to support all those who have lost loved ones, who are grieving the loss of loved ones. And so we need to do everything we can as a community right now to limit the spread of COVID-19. In a moment, you're going to hear from Dr. Carter, who will go into more detail on our rising COVID-19 numbers. But I also want to talk as well, to touch very briefly on the county indoor dining ban. What I can tell you is we last month added safety measures for restaurants and other businesses, which included a ban on indoor dining. And if I am completely transparent with you, I was very disappointed to have to do it. It was not an easy decision to do this. But since that time, it was done out of an abundance of caution and following medical advice and the advice of all of our health officials. And since that time, key COVID-19 metrics have continued to rise. In spite of all that we have done with restaurants and other businesses and all of the measures that we put in place, we have seen that our numbers continue to rise in really alarming fashion. In order to combat the further spread of this, we extended our newest safety measures at that time, including indoor dining. And what we will do is we are continuing to monitor all of our numbers. These safety measures will continue to remain in effect until at least January 29th. And it is my great hope that as we continue to watch our COVID data and use it as a guide, that we will be able to revisit these safety measures later this month. And I am really hoping that if all of us, and if I can just make the appeal to every single Prince Georgian, please go inside. Do not invite people inside your home who are not in your household. Do everything that these public officials are telling us to do. This is not a joke. It is really continuing to rise. If we do this, I believe that we can then move forward. Maybe we can begin to lift the ban that we have on indoor dining and some other things and be able to move back to some normalcy. But it is in our hands to really do everything we can to change the spread of the virus. And I urge all residents to continue, again, to be very vigilant and to follow all of our critical measures that we have been put in place, the weapons that we know work to stop the spread of COVID-19. We're moving forward with the rollout of our COVID-19 vaccines. Effective yesterday, January 18th, Prince George's County entered Phase 1B of our county vaccination plan. Phase 1B includes seniors 75 years and older, individuals in assisted living and other congregate settings, our teachers and school support staff, child care workers, and critical government leadership for continuity of operations. Our seniors are especially vulnerable to this virus, so we are proud to expand access to the COVID-19 vaccine. We're asking our seniors and everyone else in Phase 1B to please sign up and get the COVID-19 vaccine and be proud to be protected. If you know a senior who does not have internet access, we ask that you would reach out and try to assist them. And this will be a good number of our seniors who are not comfortable necessarily using the internet. We are currently training individuals to work on our new vaccination hotline. This hotline will help offer additional assistance to anyone who's making an appointment over the phone. We anticipate that the hotline will launch later this month. The last week of this month is when we expect that hotline to launch, and this will be, I believe, very helpful to many. County residents and those who work in the county who are newly eligible in Phase 1B must pre-register in order to make a vaccination appointment. And in order to know when you are able to get that vaccine, we're asking you to go to mypgc.us/COVID vaccine. We have an update post dated January 18th at the top of the web page, and that post includes information and a link to submit the pre-registration form. So we're sending out a mass text message to the 400,000 people we have in our system, and this will include a link to the pre-registration survey. So look out for that text message so that you'll receive that link, and we ask that those who receive it forward the link along to everyone you know, those who may not be in our system. When the Maryland vaccination link for Prep Mod went live on Friday, we were pleased to see that so many people quickly went to sign up for the appointments at the Sports and Learning Complex, and so we're really pleased to see that. And at this point, and again, I want to just thank Dr. Carter and thank the Health Department. They have been able to ramp up so beautifully over the last week or so, and at this point, we have about 1,000 appointments per day booked beginning this Thursday until the beginning of February, and we need to make sure that we're targeting Prince Georgians who are at the greatest risk in facing the most significant social, economic, and health challenges at this time, whether due to age or employment or access. And so as a result, after February 9th, we are resetting all of our appointments to make sure that Prince Georgians have the opportunity to receive vaccines here at home, as well as those who work here. We realized that the way the scheduling process was structured would lead to a rollout that is not equitable. And so we also realize that we have many people from outside of our county who have made a large number of appointments. And so the Health Department will send out notices to individuals who have appointments after February 9th, and they will be required to fill out our county pre-registration form online to be able to reschedule their appointments. And this pre-registration form will take the guesswork out of the COVID-19 vaccine scheduling process. And residents who complete the form will be notified when they're eligible to make a vaccine appointment. Eligible residents will be sent a unique link through our health department, which will allow them to go online to schedule an appointment. And this change allows us also to focus on making sure we're equitably distributing our vaccine doses to residents and workers who qualify under our vaccination plan. To be clear, we're now requiring everyone to fill out a pre-registration form before they receive a vaccination appointment. So if you do not already have an appointment between now and February 9th, you are in Phase 1A or 1B and you're seeking a vaccination appointment, you must first fill out a pre-registration form. And for anyone who's already made an appointment for their second shot after February 9th, those appointments will not be changed. And so I want to repeat that so that there won't be any confusion. The reset will happen for appointments that are scheduled after February 9th for the first shot. For all of those, however, who have already received the first shot of the vaccination, if you have an appointment for your second vaccination that falls after February 9th, those appointments are still standing. They do not need to be rescheduled. That appointment will stand. And while we're vaccinating those in phase 1A and 1B at this time, we're encouraging all Prince Georgians to go online, complete the pre-registration form regardless of what phase you're in. This will allow us to keep you updated on our progress, and it's very simple. In fact, I went up on that form, up on that website myself, just to make sure that you would be able to navigate it, and I can tell you that it was very easy for me to go fill it out. I got a reply email telling me that I had successfully filled it out. It just requires basic information, opt-in for county communications, and then you'll fill out a brief questionnaire. And this information will allow our public health officials to know exactly when you're eligible for the vaccine. After you are pre-registered, and once you receive an appointment through the health department, you should bring your identification with you to the vaccination appointment and your insurance card if you have insurance. And again, you must make an appointment before showing up for the vaccine. Please, we are not accepting walk-in appointments at this time. Vaccination appointments will be made on a first-come, first-served basis, and we ask for your patience because vaccine supplies are limited. You've heard this not only here, but heard it all across the country that those vaccine supplies are limited. And so if you've had trouble making an appointment, we ask, and we've heard from some who have said, well, they had trouble with the site, and what we want you to know is that you should not use Internet Explorer. It is not compatible with the state's site. The state site, which is the site that is used for these appointments, prefers Safari, Chrome, Microsoft Edge, or a smartphone. And so some who were being kicked off were using that Internet Explorer, and that was the reason that you were having difficulty accessing that state site. Our Sports and Learning Complex Vaccination Clinic will be closed tomorrow, actually today and tomorrow, because our staff in the Office of Emergency Management need to help with the inauguration security. And so we will not have that site at the Sports and Learning Center available to you tomorrow. However, beginning Thursday, we will administer 1,000 vaccines per day at our Sports and Learning Center complex, Monday through Friday, through the end of the month. And as of yesterday, all of those appointments, however, have been taken. So in addition, you should know not to worry. We are opening the Southern Regional Technology and Recreation Complex as an additional vaccination clinic. And next week, we will use the facility to train new vaccination staff. And once the training is complete, we plan to open that facility by the end of next week, and so we will have an additional site. Looking forward, we are also collaborating with the state to open a large vaccination site, which will be here in the county. It's a mass vaccination site, so we're looking forward to continuing to collaborate in order to have that operational as well. In addition to efforts our county government has made to distribute this vaccine, we're also working closely with our private partners, and so we're working with Doctors Community Medical Center to offer vaccinations to staff at dialysis centers. I've heard from many of our employees at dialysis centers who are concerned. I know that we're working with Doctors Community Hospital. This partnership allows Prince George's County to protect a vulnerable population from COVID-19 when they go to receive routine but life-saving dialysis treatments. Our partners at Prince George's Hospital through the University of Maryland Medical System vaccinated 200 seniors just yesterday, and we hope to continue these fruitful partnerships throughout Phase 1B of our vaccination plan so that more Prince Georgians, both those who live here and work here, can receive the COVID-19 vaccine. We also expect to partner with Kaiser. We're very happy about that. To help us vaccinate teachers across Prince George's County. And Phase 1C of our vaccination rollout is set to begin on Monday, January 25th, 2021. And I would like to reiterate that those who have not already scheduled appointments before February 9th must fill out the pre-registration form. During Phase 1C, individuals from 65 to 74 years of age Health and Human Services employees not covered by Phase 1A, and essential workers, including public transit operations and our grocery store employees, will be eligible to receive the vaccine. And based on estimates from the county's Office of Emergency Management, the county has approximately 25,000 people in Phase 1A, 95,000 people in Phase 1B, and 150,000 people in 1C. In total, there are approximately 270,000 Prince Georgians who are eligible to receive the COVID-19 vaccine during Phase 1. Due to the limited supply of vaccines, you know that it will take us some time to move through all of Phase 1 at 270,000 individuals. Vaccine appointments will be made available to those with a pre-registration form as our vaccine supply allows. And we're asking all of our residents to please be patient as we move through the monumental task of vaccinating Prince Georgians. And for answers to questions about the COVID-19 vaccines, vaccine safety, eligibility questions, and updates on vaccine rollout, please visit mypgc.us/COVID vaccine. Again, that is mypgc.us/COVID vaccine. I also want to issue a new call for volunteers to supplement our medical staff. I've heard from so many of my friends in the medical community who are asking, how can you help? Well, this is how you can help. We are asking for volunteers who can make sure that we can quickly vaccinate some of our most vulnerable residents. This is an all-hands-on-deck moment for our community, and we need your help to help meet the demand for health services. So today we are asking all volunteers, especially doctors and nurses working or retired, to step up for Prince George's County, and please sign up for the Medical Reserve Corps. You can do so at mdresponds.health.maryland.gov. Again, marylandresponds.health.maryland.gov. And while the service is called the Maryland Responds Medical Reserve Corps, it's not limited to doctors and nurses. In fact, medical and non-medical volunteers can sign up. So make sure to specify Prince George's County, please, during the sign-up process. We want to make sure that we are able to specify that those volunteers will come to assist in Prince George's County. And so I am so proud that in a time like this, we are able to rise to the moment and support each other as a community. And so I thank you so much in advance for volunteering your time to help Prince Georgians, and please share this information with anyone you think may be interested in volunteering. In conclusion, much like our testing rollout in the spring, our vaccine rollout is now ramping up, and over the coming weeks and months, as more doses become available, we will have greater capacity to provide COVID-19 vaccine to eligible residents. And I want to, again, urge all Prince Georgians to please take this life-saving vaccine when you are eligible. This is our way out of this pandemic. And as you know, I have received my first dose of the vaccine, and I can tell you that it was a very easy process. I went there. I did not experience, I know that some people experience some minor side effects, but I can tell you that I was just fine after it, and that I received my second dose later today. I know that many of you posed the question during the telephone town hall I had that said, listen, we want to know when you will go take it. That was the question I got. You're urging us to do this, and we want to know what about you? And they were even asking, will we get the same vaccine as you? And so there's a little vaccine hesitancy that's still there. I heard somebody say, and Dr. Carter can answer this, but as I understand, it's not true. I heard from residents who said they thought the vaccine would change their DNA. As I understand from the medical professionals, this also is not true. I can tell you, as far as I can tell, I see the same person, and Dr. Carter assures me that this is safe. So I urge everybody, please, when you are eligible, please take the vaccine. And so thank you again for all of your efforts. I want to end by saying something that I said a little earlier, again, that is so important. We're not done, unfortunately. Even though the vaccine provides for us a ray of hope, I want you to know we are not done with COVID-19. I am hearing daily of friends and neighbors and others who have become sickened by this virus, and it is something that we're still very much in the midst of. So we need you all to please take all of the measures that you have heard us talk about over and over again. Just avoid unnecessary travel, making sure that you are still not congregating with people outside your immediate families, and just do what we have to do so we can please get this behind us in the rearview mirror, and we can do that together. So thank you so much again. And at this point, I will welcome our Chief Health Officer, Dr. Carter, for his update, please.
Thank you, Madam County Exec. Good morning, everyone. The vaccination rollout is getting a lot of attention lately, but let's not forget COVID is still raging in our community. So let's go through the latest data. As anticipated, COVID-19 increased after the holidays. We had a new record high of over 3,700 cases the first week of January. For last week, cases appear to be trending down a little bit, but don't take that as something as a trend. It fluctuates. We're still extremely high. Just to give you a little context, our lowest number of cases in a week was in late June was 578. We had more than that in a single day on Monday, last Monday. So we're very high. Meanwhile, our daily case rate of is more than 50 new cases per 100,000 population, which remains critically high. We've seen a slight decrease in our hospitalizations also. After 3 consecutive weeks of more than 200 folks in the hospital, now with COVID, we now have just under 200. But again, that fluctuates. I should warn you that the virus itself will get much more active in the next few weeks. The highest number of COVID patients in the county hospitals was 262 in May. Right now, where our hospitals are about at 48% capacity of their hospital beds, both ICU beds as well as our surge beds. Our hospitals have done an amazing job of adding temporary ICU structures throughout the pandemic so they can continue to provide care to our residents who most need it. Of the ICU beds right now, 50% of them have COVID patients in it. We will continue to monitor our health care capacity very closely. The latest 7-day average shows our COVID test positivity rate is on a slight decline, but it's still over 10%, which is high, very high. We have to stay above 10. We've been staying above 10% for the last 2 weeks, and that means that 1 out of every 10 tests is positive for COVID. Our infection rate remains above 1. The infection rate measures on average how many other people are infected by a COVID positive person. At last check, our rate was 1.06. In other words, more than 1 person is infected by someone else with COVID. I want to be sure that I get that clear. More than 1 other person is infected by someone who has COVID. The latest key metrics prove COVID-19 continues to spread at a really rapid rate in Prince George's County. That's making a whole lot of our folks sick. We cannot let our guard down. Getting back to normal will take all of us staying smart and staying safe. Wearing your mask over your nose and mouth every time you're in public. Stay at least 6 feet from each other and limit gatherings to only the people who you live with. Keep your hands and your surfaces clean as much as possible. If we keep doing these things and get enough folks vaccinated, we will get to the finish line. This week, we entered phase 1B of our vaccination rollout. And Madam County Executive told you all a lot about this. I'll just reemphasize some of it. The people who are eligible in this phase to get vaccinated are senior citizens who are 75 and older, those in assisted living and other conjugate living facilities. This includes staff and residents of homeless shelters. We're also vaccinating teachers, school support staff, members of the county's higher education community, as well as child care workers. This phase also includes critical government personnel to ensure continuity of operations. We are focused on vaccinating these groups of people who either live in Prince George's County or work in Prince George's County. Jurisdictions across the state are focused on the same thing for their residents in their workplace. Every county is vaccinating as many people as they can. and we are doing it as safely and equitably as we can. Each jurisdiction must be mindful of their vaccination numbers and their supplies that they have on hand. We must manage the delicate balance between vaccine supply and vaccine demand. And that's difficult right at this time. At the same time, we must ensure everyone has an equal shot of getting the shot when it's their turn. That's why we want to make sure our county seniors get vaccinated, as well as everyone else in Phase 1B who's eligible. To make sure we meet the shared goal, we are resetting appointments scheduled beyond February the 9th. The county executive mentioned this as well, but it needs to be repeated. If you have an appointment after February 9th, you will receive a notice and instructions to fill out a pre-registration form. The form is on our website, mypgc.us/COVID vaccine. Once you submit the form, you will be notified when you are eligible to make an appointment for your first dose, as appointments are available. After you receive your first dose, you will get an email with a private link to schedule your second dose appointment. We are working on setting up second dose registration sites as we speak. I also want to be sure you know that when you arrive at your vaccination appointment, be prepared to, 1, show your ID, and if needed, show your work ID. Also, if you have insurance information, please have it ready, although it's not required for you to get the vaccine. Keep in mind, vaccinating hundreds of thousands of people in a short time frame is unprecedented. It's an enormous challenge for local governments such as ours, healthcare workers, and emergency management officials. It is a big challenge for you all too. This pandemic has tested us like never before, so we're going to have to ask you for some patience, because it's going to be difficult to do this, but we're prepared and we're ready to go. Remember, we're in Phase 1, and in Phase 1 alone, as Madam County Exec said, there are almost 270,000 folks in that phase. That's a lot of people to get vaccinated in a short period of time. Please know that we are working harder than we've ever worked before to keep you safe and healthy. Part of that work includes ramping up our vaccination operations to historic levels. Each day we get hundreds more shots into people's arms. At the end of the week, we expect to vaccinate 1,000 people a day at Sports and Learning Complex. We're training more vaccinators next week so that we can open a third site in South County. I'm excited about the growing numbers of community partners we're teaming up with, and expanding our vaccination capability. While we know the demand for vaccine is growing, I also know many of you have reservations about the vaccine. Well, I trust the science. The vaccine will protect us, and protecting us will get us back to normal. I had my second dose today, and I feel pretty good. I just had it a couple hours ago. And I'm telling you that, and as I had to tell my father-in-law last night, you, who's 86 years old, you're going to get this vaccine, because we need for you to be protected. Thank you.
Good. Thank you, Dr. Carter. So with that, we will open it up to any questions. Yes, Will.
State President Bill Berg said that COVID-19 vaccine is not being distributed efficiently. What can you say about what you think the distribution can be done better for the county, from the state, and also just estimate how many doses the county needs?
Okay, so on the question about efficiency, you know, you've heard this said all across the country. In fact, we heard President-elect Joe Biden also say that he had concerns about the way that the vaccine rollout has gone. None of us have ever been in this situation before with the mass vaccination need like this one, but what I can tell you is I'm proud that the county has truly ramped up. The ramp up has been incredible. As we mentioned, just at one site alone, for example, the Sports and Learning Center, we now have the capacity to vaccinate 1,000 people per day. And that does not include all of our partners across the county who are likewise vaccinating at the same time. And so Dr. Carter can give you a better sense for the numbers. I think it's 13,000 that we vaccinated in the last. Anyway, we have really ramped up. 1,000 just at one site, but we get several thousand done per day in the county, and we're, ever increasing. As I mentioned, we're going to be opening a site in the south part of the county by next week. We're working with the state in collaboration to open a mass vaccination site, hopefully at a site in the county. So we're doing fairly well, but it was a tough start for us, as we were very transparent about, and we are, as you heard today, asking for volunteers also, because it's not just the sites that become important. We also have to have the personnel to do this, and so we're ever growing.
Dr. Carter, anything you want to add?
Yes, just one quick thing. The state has done a great job in terms of distribution. It is coming from the federal government to the state. That's been the problem. The state itself has done an excellent job in terms of distributing. They're not getting a lot of vaccine from the federal government. All of that's getting ready to change. Everybody's excited about the new administration, the way they're going to approach it. So, and you'll see that reflected in how we operate also, because it trickles down. So I just want you to know the state's doing a great job. We're receiving vaccine, but as you know, because of the way the federal government has been distributing it, it's been fluctuating. We didn't know how much. People don't know whether we're going to get some next week or the week after that. So it's very difficult to manage it. But I will say the state has done a great job at this.
Hang on.
And let me just also add one other thing, Will. So as of last week, we do have some information that I wanted to share with you, that as of last week, before we got an additional shipment, which we got at the end of last week, we had administered 82% of the vaccinations we had on hand. So that gives you some sense about how we are doing. I know that was your question. So as of last week, we had used 82% of the vaccine supply we had. Now, we have since gotten an additional shipment, which we are grateful for. So we're not at the 82 right at this moment. We're still administering, but that just gives you some sense about how well we're doing.
I'm sorry, Tracy?
Do you have, so you were mentioning equity in terms of how the vaccine is going out. Montgomery County residents have been coming out to Prince George's County to get vaccinations. Do you know how many and how that's impacting? And then also there's some real confusion about whether this is where they're supposed to come out.
Okay, so I'll let Dr. Carter please answer that, but we want people who are living here and working here definitely to get their vaccinations here. But Dr. Carter, would you address that?
So we've had some folks come from Montgomery County over to get vaccinated here, and I'm sure we've had people from Prince George's County go over to Montgomery County. I don't know the numbers that have gone over, but we anticipated that. Montgomery County has anticipated, the state did. We've had a lot of conversations about that. And we intend to make sure that, as Madam County Executive said, it's equitable. So ultimately, we want to be sure that everybody in Prince George's County gets the vaccine, and we're sure of that. But they also Montgomery County wants to be sure that all of their folks do. So we're working close together. Our county emergency management they've been in constant conversation. And so this is anticipated, but we're working through it as every county is.
Good morning, Sierra Fox with Fox 5 DC. As of last Friday, how come only 3,000 of the 14,000 doses of the vaccine had been distributed? Is there a distribution problem? Are people hesitant? Or is there just fewer residents in early approved categories?
Okay, you know what, so I can address that. It's not 3,000. 3,000 would be the portion just administered through our health department. There was more like 13,000 because we have partners. In other words, there are categories. The healthcare workers are at the hospital. We have the pharmacies who are helping. So it's a collaborative effort throughout the county. So it's not that there were 3,000 administered in the county. That's just the portion administered by the county's health department. So I hope that does it. Was there anything further in that question?
Only 3,000, but you have 14,000 doses?
No, there were 13,000 plus doses that were administered. The 3,000 that you're talking about would be the portion at the county's health department. In other words, remember the county has partners who are also administering doses at the same time. So we have the hospitals and others who are also administering doses at the same time.
And a follow-up is we're hearing that younger people are sometimes being able to get these vaccines, we've seen on social media and heard, but they're not in the category. How are you guys handling that?
I don't know that Dr. Carter can answer.
Well, we've been handling that really well. Because when a person, right now, when we first started out, of course, and we were in 1A, there was a category of folks. We were getting lists from those category of people and sending those specific people emails. And when you register, you actually have to put in your age and what your work. And so we've been checking our list against people who've come in. And a lot of that was what has to happen when you first start up. So we haven't had I don't know what your data shows, but we haven't had a lot of young people coming in and getting vaccinated.
And if people are trying to do that, what's your message to them?
That they will get vaccinated. We're going to get to them as their time comes.
How big an issue is hesitancy? And I heard last week that something like only 30% of the first responders had signed up. Is it hampering you? And I have a quick one after that as well. Is hesitancy hampering your efforts?
I would, of course, there are people who are hesitating. And we have a whole effort to make sure that we get people over on the side. But it's not as big a problem, I don't think, as you might anticipate. When we opened up the floodgates, a lot of people are ready to go with it. And I think what's going to happen, to be perfectly honest, as more people, like I've gotten it and I've had my second dose, when people that people know get it and they see that they're doing okay, it's going to exponentially rise. We're preparing for that. Because we knew it in the first month or so is going to be some hesitancy. But just like anything else, this is a safe vaccine. And once people really realize it's safe, I have every confidence that our Prince George's County residents will get to that point. We're going to have the floodgates. So we really haven't had as much. That hasn't been the biggest factor.
While you're there, Dr. Carter, can you say how many people in 1A, what percentage of 1A got vaccinated?
I don't have that number on the top of my head. I knew you were going to ask me that. I don't have it on the top of my head. I'll have to get back to you on that. So I'm sorry.
And one question I had following up, I think for Dr. Carter, would be, if you don't have the percentage of people who got vaccinated in 1A, whether you have a sense that there were more appointments available in Prince George's for Montgomery County residents to take because there was a lack of, or a sort of hesitancy in 1A. Like, were there open appointments because people weren't getting it in 1A?
I know. You mean why the Montgomery County residents came over? I think they came over because we opened up on Monday, followed the state's guidelines about going to 1B, and a lot of folks who are 75-year-olds just said, "Hey, it's open, so let's go." So, I mean, I don't think it's any more complicated than that.
So one other quick thing. You done there?
Yeah.
Okay. So what Will was talking about is right when you were having your press conference, Bill Ferguson was having his press conference, and he had some really strong words of criticism for the state rollout. And what he's saying is, look, there's 300,000 doses, and those are the state numbers. I just looked again. About just under 300,000 doses that are just sitting out there somewhere. Where are they? Are they in the hospitals? Are they? Who's got these 300,000
Oh, I'm sorry.
mystery doses?
Oh, I'm sorry. You know what? I haven't seen the President Ferguson's press conference.
I'll tell you. So he just formed a task force to basically supervise and monitor what Hogan's administration is doing.
Okay.
He started with some strong words of criticism and saying, look, there's 300,000 doses out there that haven't been given.
Okay.
And I know Montgomery County, I was talking to some folks over there saying, hey, the hospitals are all hoarding it, waiting for their people.
Okay.
I think Hogan's do you think there, I mean, what do you think about that and this notion that it's not going so well to the point that the Senate president has to?
Well, I trust Senate President Bill Ferguson. I know him well, and if that's the information he had and he shared, I do trust his information and his assessment of it. I don't have that information, and maybe Dr. Carter has a better sense of it. We've been just laser focused on trying to disseminate the supply that we get here, get it out, get it in arms of the people who are here. But if Senate President Bill Ferguson said that this is the information he has, I definitely trust his assessment of it.
And do you know at this point how many people who are from Montgomery County or other counties have signed up for appointments in Prince George's?
I haven't got the exact number. It's greater than 30% and less than 50%. That's all I know. I don't have the exact numbers on that. And I don't want you all to make a big deal out of that because the health officers don't make a big deal out of it. We talked about it. We know that this is going to happen. You know, you can imagine in some counties that have the beach, people who have beach houses, they are from all over the county and the state, in different states. But because this vaccine was paid for by tax dollars, then they come and they got an appointment, you give it to them. And you have to, and it's a balance between making sure you take care of your residents. So what we're doing is making sure that we collaborate. Prince George's with Montgomery, Prince George's with Charles, Prince George's with Anne Arundel, so that we can be sure that they take care of some of ours, and we'll have to take care of some of theirs, because it's unavoidable that you're going to get some of this crossover.
After February 9th, it'll just be Prince George's County residents.
Well, after February 9th, we're making sure that, no, not necessarily. It's just that we're making sure that we have better control over how these appointments are coming about and understanding, you know, who is actually getting that vaccine. They are in the right category, but, you know, we want to be sure we understand those numbers moving forward.
But you still could get the vaccine in a county where you don't live after February 9th.
Yeah, I mean, there's no way that anybody can say you can't.
When I was looking at the stats, the statewide stats, they had a listing by county of the percentage of population vaccinated. And I couldn't help but notice that Prince George's had actually the smallest percentage. Why is that? And then is what you're talking about going to change that rapidly?
Oh, absolutely. What I'm talking about is going to change that rapidly. I mean, we anticipate, we're a big county, so our percentage is going to look little. We may do as much as another county, and our percentage looks very small. So, but, you know, that doesn't drive us. What we're driving is making sure that we have quality sites, that they're run efficiently, and that's where we are. So I think if you just give us a chance, you're going to see us soar.
Did you want to make that point? I can make it. Wait, hold on, please.
So one other thing, Brad, I wanted you to know about 1A, and I think maybe this will be helpful to the discussion, is remembering that 1A was largely connected to your employment. So in other words, we had firefighters, police officers, other workers who were vaccinated in 1A, and so that means that some of those folks were from other places as well.
Thank you.
Yeah, and it also addresses to some extent some of the age.
Oh, so they would have been counted in another county's stats?
Well, they would be counted in ours with the.
Charles County resident firefighter vaccinated Prince George's might be counted in Charles County for their stats?
It means you could be vaccinated where you work. So you can be vaccinated where you work or where you live. And some of the people who we vaccinated in 1A were people who were, because of their employment, vaccinated here who may have lived in a different location.
Prince George's County is one of the most affluent Black communities in the country, yet that group has been hit hardest during the pandemic. So what's being done to help that group specifically? Is there a way to get vaccines out to that group earlier?
So you're just making sure I understand your question. You're talking about the fact that we have a very large population of Black and brown residents. And you know what? And we also have, by population, some of the a largest percentage of individuals 65 and older. And so those individuals who are able to be vaccinated in phase 1, we're getting to those folks as quickly as possible. And you'll find a large number of the people that you're talking about, of course, because our population in Prince George's is majority African American. They will be African American, majority of them, and they are also, by population, we have the largest percentage of people in the state who are 65 and older. So a large older population or more senior population. I'm getting closer to that age every day myself, but you'll see them here. And when you say, what are we doing? A whole host of things that don't have to do with the vaccine to make sure that our residents don't suffer from those comorbidities that we saw happen during COVID-19. They were exposed in really amazing ways during this pandemic. We're working to make sure that we increase the grocers who are coming into the county. We have a whole campaign now against diabetes to work to help our residents who have become sick with diabetes, but eliminating food deserts is a huge thing. Also, health equity. The issue around health equity was exposed in really devastating ways during this pandemic. We need further access to health care, so we're really excited about our hospital opening in June. We'll be working to try to expand the size of the hospital, for example, in the southern part of the county that we've been working on now for probably more than a decade to make sure that health access. We're working also on behavioral health issues here where we have really suffered, opening very soon a facility to help with mental health care. So in any way, health equity is a big issue here, but COVID has given us a renewed opportunity to focus on it and to get the support that the counties needed.
One more question.
I'm sorry, this is my last one, but I just want to make sure I understand. So how are you going to make the vaccine rollout, make sure it's equitable if you're not able to tell people who don't live in Prince George's they need to get their vaccine where they live?
Yeah, so the pre-registration that we talked about helps us to do a better job of looking at who's being vaccinated, and that's part of why we are saying now every person who receives the vaccine can only do so after pre-registering, and that will give us the information we need to help us make those decisions. Where do you live? What is your age? To make sure that people are in the proper categories and getting vaccinated at the proper time. So that's what we mean by equity, is just making sure that the people who are most vulnerable and who are in the greatest need of the vaccine have the opportunity to get the vaccine first. And that pre-registration will help us to do that. Dr. Carter, I don't know if there's anything additional you want to add. Okay. There, through January, I believe we're out of those appointments. Is that Dr. Carter can answer?
And I don't know what percentage of those folks live in North Prince George's and are in other places, don't know.
Right now, we're booked through February 9th. And after that, we're taking the pre-registrations. Any Montgomery County resident or any resident that has an appointment before February 9th, everything will be honored. And if you need to know the percentage of that, we can get you those percentages. I don't have it off, like I said, I don't have that off the top of my head. After that, we're doing the pre-registration, and it'll move forward from there.
So people can't make an appointment till later in February?
They can't make, they can pre-register so that, and then we're going to allow, once we open up after February 9th, they'll be allowed to make appointments after that.
And that link will be sent to them by the health department.